Hello, my name is Ian Meyers and I'm a general dental practitioner in Brisbane, Australia, and Honorary Professor at the University of Queensland School of Dentistry. I do a lot of conservative restorative dentistry, and one of the most important factors in achieving great outcomes is ensuring that the tooth surface is cleaned appropriately before any restorative intervention. My clinical tip today relates to using a simple technique for ensuring we have the cleanest possible tooth surface and best restorative interface, which will ultimately enhance our adhesive bonding and restoration longevity. So while it's well accepted that tooth surfaces need to be cleaned prior to etching, conditioning, priming and bonding, many of the techniques we currently use may either cause damage to the surface of the tooth or may leave a residue which can impact on the final result. In clinical practice, an abrasive pumice slurry or prophylaxis paste is frequently used to remove surface contaminants prior to restorative procedures. Unfortunately, due to their abrasive nature and composition, these may not provide the best outcome. What has been shown to be more effective and efficient is the use of an air powder cleaning protocol, using the appropriate non-abrasive prophylaxis powder. I must stress here that I'm talking about air prophylaxis and polishing, and not the more destructive air abrasion procedure. So prior to any restorative procedure, I recommend cleaning the surfaces of the tooth by using airflow prophylaxis, which incorporates a 14 micrometer erythritol prophylaxis powder. This effectively removes plaque, pellicle and surface stains from the tooth surface without causing damage or leaving any residue or contaminants. This ensures that there is an ideally clean tooth surface ready for the next stages in the restorative procedure. So regardless of the adhesive bonding agent or adhesive cement you are using, and prior to any etching, conditioning, priming or bonding procedure, I strongly recommend that you ensure the tooth surface has been cleaned optimally, and to do so, the most effective and efficient way to do this is using an airflow prophylaxis. This technique can also be used for cleaning tooth surfaces prior to the application of remineralising agents, or when sealing the surfaces of teeth for ongoing protection. So a clean teeth surface means a better clinical result for the practitioner and a better long-term outcome for the patient.